Hello everyone. So today I'm going to be talking about my topic 8 of my nursing surgery practical class, which is sputum collection. So what is a sputum collection, or what is a routine sputum culture? So practically, when a person has a respiratory tract infection or a lung related disorder, our lungs produce a thick substance known as sputum, and this substance can make it hard to breathe, cause coughing, and harbor bacteria. So if a patient experiences any one of these symptoms, the doctor may recommend a sputum culture. So a sputum culture is relatively a painless test which helps laboratory technicians to study the bacteria or fungi that might be growing in our lungs and cause the production of sputum. This can help the diagnosis process of our patient's illness very easily. Often, the most difficult part of a sputum culture is getting enough material in a sputum sample for testing. So what are the uses of having a sputum culture test? So the sputum collects in the lower parts of our lungs and bronchi, which are the tube-like pathways that the air moves through to reach our lungs. And the symptoms that may indicate the need for a sputum culture test are cough, fever or chills, fatigue, muscle ache, breathing difficulties, chest pain, confusion. The test can reveal what may be causing the cough and other symptoms like bronchitis, lung abscess, pneumonia, tuberculosis, chronic obstructive pulmonary disease, and cystic fibrosis. So certain harmful bacteria, viruses, or fungi can cause respiratory conditions. So by determining what may be the cause of our symptoms, the doctor can find the best medication to cure the infection. So how is the test usually performed? So a sputum culture requires minimal effort on the patient's part. So all the patient needs to do is simply to provide the sample to the lab test. So the patient will be asked to cough deeply to bring up the sputum from our lungs, deep from our chest. And sometimes saliva that comes up from the sputum collection when a person coughs is usually from the mouth and upper airways, is not useful for the test. So a certain techniques can be used to get a good sputum sample. For example, drinking plenty of fluids, which can help loosen the secretion and make it easier to cough up sputum. Or we will be asked to spit the sputum into a small cup, and the laboratory needs at least 2 milliliters of the sputum for testing. And to cough deeply from our lungs, we might need to take 3 or more deep breaths to cough forcefully. If a person is having trouble coughing, the doctor may try to tap on the chest to loosen the sputum. They may also have to inhale a steam-like mist to help us cough up the sample easily. There are also certain risks to the test. So let's say when a person isn't feeling well, the deep coughing that is associated with the sputum culture may be uncomfortable and may experience some chest discomfort. However, there are no practical big risks associated with having a sputum culture unless a person has abdominal surgery. They will be asked to hold a pillow over the stomach before coughing to minimize abdominal discomfort. This technique is known as splinting. That is all from me today. Thank you so much for listening.